Hey everyone, it's Dr. Rick, founder of Herbal 411 and integrative primary care doctor. Today I'm going to talk about fiber. A lot of my patients that I see in an integrative medicine clinic or in the immediate care center where I work are cutting down on their calories. And that's a good thing. For the first time in a few decades, the heart disease death rate is plateaued a bit. So that could be associated with all the GLP-1s, the Mounjaros, the Ozempics, and all the other ones that are coming out now. And I got to tell you, I'm going to be doing an unboxing on this newer sublingual GLP-1. It's Ozempic sublingual instead of a shot, and it's a lot cheaper than $600 or that outrageous price that everybody's paying. It's with a compounding pharmacist in Indiana, and I'll be doing a video. Please consider subscribing to my YouTube channel. Otherwise, if you are decreasing your calorie count or if you're low carb, you're probably not taking enough fiber, because everybody thinks fiber and carbohydrates are the killer. And I'm going to say that they're not. I think overeating is a killer and processed food is, but if you're having problems with your stool, or if you're having problems with taking in or deciding on fiber, this is a pretty decent substitute. So it's Psyllium husk by Organic India. This has always been my favorite, and I have done a video on this before. And I'm going to restart it because I'm having digestive issues. But the way you do this, and you can get this online, I don't think Amazon can fake this. You know, they don't really check their third-party suppliers, but I got this at Whole Foods. And you just take 1 tablespoon, which is 3 teaspoons, and you put it in water. And even on the side of this box, it says, or this canister, it says, drink quickly. And you can see it's solidifying very fast. That's what fiber does. It's we can talk about soluble versus non-soluble, but the bottom line is, if you are practicing a low-carb diet, you're probably not taking that much fiber in, a few veggies. Those of you who are trying to get Ozempic, you know that Ozempic works by slowing down digestion. It keeps food in your stomach for a longer amount of time, and it makes you feel fuller. So taking in fiber or doing high protein will do the same thing. So this is a fiber shot. I'm going to try to down this quick, but I like to put now B12. This is my B12. I'm doing 2 unboxings, but the B12, I don't really need B12 because I eat too much meat. However, I use it for flavoring, and this is what I do with the psyllium husk. Did this before when I was big into probiotics, and that's another reason that you should use it. It does help the stool bulk up, so that's kind of cool because it helps diarrhea stiffen up, but it also helps constipation loosen up. So it balances things out, almost like trifalin. I have done a video on trifalin, neutralizing the gut. It does help the gut in that way. So acting as fiber or insoluble fiber, we don't have to talk about soluble versus insoluble, but this is just fiber, especially if you're on a low-carb diet. So if you also want to have satiety, then this will stay in your stomach longer, and it'll give a sense of fullness, so you don't have to have the munchies right after eating French fries, for example, or Red Bull. Having stuff in your stomach for a long amount of time tells the brain, I'm not hungry. Now, things in the stomach that stay there longer can be protein, because protein takes a lot longer to digest and needs acid and emulsifying, or fiber like this. So I'm letting this sit too long because it's going to be hard to swallow as it's solidifying. But I'm just talking about the benefits. And 1 is to give you satiety. 2 is to lower your postprandial glucose. It's getting really thick. This is going to be able to stand soon. Lowering your glucose after you eat is really important for hemoglobin A1C, or your 3-month hemoglobin. That's another benefit. I think it actually lowers cholesterol because it keeps that in your stool as this goes through the stomach, small intestine, and colon. And finally, it does help, I believe, in your acting as a prebiotic for your probiotic. Probiotics are great, and I would probably change your probiotic every 3 months. Or take in fermented foods. The work of Chris Gardner out of Stanford showed that fermented food will do it. You just have to be very slow with adding in the fermenters. You might be able to lower your triglyceride level and your cholesterol level, and you'll lower your hemoglobin A1C. When we go in a low-carb diet, your gut microbiome might suffer for a while. You'll probably feel great for about 3 to 9 months or 12 months, but then you'll plateau. So we're going to do this now. Flavor is because of this. There is a basic flavor with psyllium husk. It's more tolerable than Metamucil. I've seen Metamucil. I mixed it up in my old office, and it was like diarrhea, sorry. It'll continue to solidify, so you have to chase it with fluid. It's evening time now where I'm at, and I'm going to have to take a little bit of fluid But I'm used to this, so I don't have to worry about this concentrating like concrete in my stomach. So you can see it's really solidified at the end. I'll have to use my spoon. By the time I saw my third or fourth patient, if I didn't finish it, a spoon would be straight up and down and stuck. I obviously, it wouldn't be like concrete, but it would be pretty thick. So I'd have to spoon it in an almost semi-solid state. Try 1 tablespoon in water every day. You can mix it in with creatine. I'll probably do another video on my creatine dose that I usually take a shot of in the morning. But if you are plant-based, this still helps with regards to balancing out your fiber content. And you will probably need B12 more than us low-carb people. So that's about it. I like the taste of this one. You can try different platforms of it. You should take it in the morning, as you will be able to chase it with a few cups of water and have that fullness that stays with you, and you won't even need the GLP-1. So give it a try. Consider subscribing. So thanks for watching. Take care. Have a healthy day.